Hello, I'm Dr. Ryan Kazemi. In this video, I'm going to demonstrate how removal of a fully integrated and healed dental implant can be done without a single incision or bone removal in less than a minute. This patient had this implant placed many years ago with non-specific facial pain and headaches since it was placed. The implant itself appears to have healed quite well with no signs of infection or inflammation. And the only significant finding was its perforation into the nasal floor, as the implant length was simply too long for the site. Although no direct relationship between the implant and her symptoms could be established, patient had elected to have it removed as a possible solution to her chronic pain. This is a Camlog dental implant, and I will now demonstrate how it can be removed conservatively and quickly with a reverse torque technique. As we note in this case, the implant is very close to the adjacent tooth, so the old conventional technique of cutting the bone around it will simply not work, as it will be too damaging to the adjacent tooth and structures. Instead, we will use a unique technique to rotate the implant out. For this, I first place a special reverse torque screw in the implant body and then tighten it in reverse. Then, using a high reverse torque wrench, I place gentle and consistent load of less than 250 Newton centimeters on the implant. It is critical to use this instrument cautiously with great amount of control, as any excessive force can result in fracture of the implant, bone, or possible injury to the adjacent teeth. The implant is then rotated out and removed. The site is then gently cleaned and irrigated. And we'll then place a small amount of bone graft material as a way to preserve the ridge, since the patient wants the replacement of this implant and tooth in a few months. The recovery is quite quick, with minimal discomfort and no swelling. And the site heals completely in 3 to 4 months and will be ready for the placement of the new dental implant. This is a tremendously effective and minimally invasive technique for removal of ailing or failing dental implants, regardless of their type and make, and also regardless of when they were placed and how integrated they are. Thank you.